It's another day with the physicians where your health is our business.
Growth spurt to end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have your hormones.
Sugar, and I don't know about any other one, but what do you know?
You're welcome back to the Planet Ultra of your regular program. Macular degeneration, also known as age-related macular degeneration, is a medical condition which may result in blood or no vision in the center of the visual field. Early on, there are often no symptoms. Over time, however, some people experience a gradual worsening of vision that may affect one or both eyes. While it does not result in complete blindness, loss of central vision can make it hard to recognize faces, drive, read, or perform other activities of daily life. Visual hallucinations may also occur, but that does not represent a mental illness. Our expert today will be talking to us about age-related macular degeneration. Stay tuned. It's another day with the physicians where your health is our business. Today we'll be talking about age-related macular degeneration. My name is Dr. Martina Agbere, and with me, as usual, is
Dr. Amina Yusuf Kadri. It's always a pleasure gracing your screen. And don't forget, all the physicians, your health is always our business.
we're talking about macular degeneration. Anything that has to do with degeneration, what comes to mind first is like age.
Yeah.
And now we're talking about age-related macular degeneration. When we talk about macular degeneration, macula,
something about the eye.
obviously.
That's for, if you know, because for the layman out there may not really know what it is, but it just means that something related to the eye. But the most important thing is that the word degeneration.
Yes.
It means something is progressing, something is aging, something is, can move from mild to severe.
Yes. For us to pick this particular topic, macular degeneration, emphasis on macula, it simply means that the macula is actually very, very important. It's an important part of the eye.
It shows the tiny details. The more detailed part of your vision is optimized there. From what Prof has said regarding the macular part of the eye. So
when again we know we have Prof coming.
Now always
each time we have
get my pen ready.
It's like she's always on fire.
Encyclopedia.
She's always on fire. So I look forward to it. So I really don't want us to talk much, discuss much about this topic because the encyclopedia herself
is coming.
Age-related macular degeneration, that is the topic for today. If you do not have your biro and paper with you, just keep your cell phone aside to pay detailed attention to what will be read out in the course of the program. Don't go away, we'll be back after this short break. Stay tuned. Welcome back. If you are just joining us, you're on to your regular program, The Physicians, where your health is our business. I'm particularly excited because today we'll be talking about age-related macular degeneration. And to handle this topic, to do justice to the topic, is one and only Professor Adeola Onakoya. She is a consultant ophthalmologist. She is a lecturer. She is a professor in the College of Medicine, University of Lagos. Prof, you're welcome to our program, The Physicians. It's always very exciting.
Thank you.
Having you looking very radiant as usual.
Thank you very much. Makes me hungry to do it, Prof, you know. And I'm telling myself, maybe it's time to
You're welcome.
teach your constituency and be a delectable looking and awesome Prof. Prof, you're welcome.
Thank you.
So we're going to be talking about age-related macular degeneration.
Right.
Do you want to just give us an overview of the eye so that we know where the macula is before we now talk about how it gets degenerated?
Yes. Now, talking about the eye, maybe I should
Yes,
use
go
this
ahead.
to demonstrate. Well, the eyeball is actually made up of two unequal halves of spheres together. This is one part of the sphere and this is the other part. This 5/6 is bigger than this 1/6. Now, this part, you know, we have like 3 layers. This is the outer layer of the eye, which is known as the fibrous coat, in 2 parts. One part is transparent, the other part is opaque. This transparent part is what enables us to process vision at first, you know, because that is the first point of contact of rays of light or whatever you're looking at with the eye. And 70% of our being able to see actually depends on this tiny structure, which is called the cornea. It must stay transparent as it is. If it's not transparent, then you won't be able to see. For instance, if it goes opaque, maybe there's a trauma or there's an infection whereby you now have an opacity, which is scarring of the cornea. There's no how the rays of light would get inside the eye for the processing of vision to take place. So cornea is very vital. This is cornea. It's very important for vision. 70% of your being able to see depends on the clarity of this cornea. So it must stay transparent. No trauma, nothing must happen to it. Okay. And then we have, there are 3 layers, like I said, the outer fibrous coat, and then the middle layer. We can only see one part of it. That middle layer is in 3 parts.
Again.
Yes.
So
it's in 3 parts. So I'll take this out. So this is the first part of the middle layer, which is known as the iris. It is this iris that gives the color of your eye. Some people have blue iris, even though some of us, we tend to change it to blue contact lens. Like the Caucasians, some of them have blue iris. But Africans, we have brown or dark brown iris. And the dark brown and the brown iris, there's something it's doing, is to help to reduce the amount of light that gets into the eye. So it's absorbed at that level. Even the ultraviolet rays is absorbed at that level. So it's protective for it to be brown or dark brown. And then that is just first part. Then the second part of it, which is hidden from us, is known as the ciliary body. That produces the fluid that we have in the eye, which helps in nourishing the eye. And that fluid is produced at a particular rate. And if it's being produced, it nourishes the eye, then it drains out through that corner there known as anterior chamber. The last time we spoke about glaucoma, we talked about this. And the rate of production should balance the rate of drainage. And if there's a problem with the drainage, that is, you have accumulation of that fluid in the eye, then it backs up, presses on this vitreous, and then it destroys the nerves inside the eye.
Wow.
That is when we talk about glaucoma. Now, so if we leave the ciliary body, then behind it we have the choroid, which is the part that houses all the large vessels in the eye. So anything that is in the body, that is in the system, and be it an infection or whatever is flowing in your blood, would get into the eye through this choroid, because that's where you have all the vessels. You know, in fact, about 80 to 90% of the vessels in the eye, they reside in the choroid. So that is where, if infection is in the body and it gets in the eye, that is where it starts from. People even have cancer. You can have hematogenous spreading through the blood, maybe cancer of the breast or cancer of the lungs. You can have it spreading, yes. It spreads, you know, through that blood vessel, and it gets into the choroid, and then if it's very close to that part that is for responsible for sharp detailed vision, then patient is symptomatic at the very early stage. But some patients may not be symptomatic at the early stage, especially, you know, if it's not in the macula. You know, maybe later somebody is just examining the eye and then sees it and say, what's this? Then does some investigation, do an OCT, and then sees that or scan that it's a growth that is there, and then that's how some people are diagnosed with lung cancer. We've had patients like that.
Wow.
So that is the second layer. Then we have the innermost layer, which is known as the retina. Now the retina is like a cellophane. It's like a membrane. It's quite transparent, and it lines the inside of the eye. But it's not just transparent. There are cells in it. In fact, there are 10 layers there. You know, we talk about from our lecture in biology when we were in secondary school. We were taught about the rods and cones, you know, which are the sensitive, photosensitive cells. And apart from that, you know, you also have some other cells, you know, that are lined on top of it. But the photoreceptor cells are the ones that receive the rays of light, and then you have the processing of the light rays before it eventually gets to the retinal ganglion cells that we talk about in glaucoma, before it passes through the nerves, you know, those tiny axons that forms the optic nerve, and then it then takes the message right through to the brain. Now, when we now talk about the retina with reference to age-related macular degeneration, now the retina, there are 3 vital areas that are important. One is the optic nerve head, where you have the aggregation of those nerve fibers. Is known as the optic disc, or also referred to as the blind spot, because there are no cells there. It's just the aggregation of those fibers. And then we have the macula. The macula, which is actually located temporally in the right eye, is towards the right, and then on this side temporally. And that is where you have the highest concentration. You know, we were taught that the rod cells are for night vision and the cone cells for day vision. Now, in that macula, you have the highest aggregation of the cone cells, and is nasal, you know, is at the central, you know, when you are looking straight, those rays of light is going there straight, you know, the straight line view. And then you also have the highest aggregation of those cells we talk about in glaucoma, the retinal ganglion cells in the macula. So macula is that area of the retina that is responsible for sharp, detailed vision. However, that area is very tiny, the layers are very thin, and which is what will explain the susceptibility to macular degeneration, because you have the rods and cones, and then you have the pigment epithelial layer. And now, so between the choroid, which is the second layer, and the retina, that layer, which is known as the retinal pigment epithelial layer, is what is responsible for providing nourishment to the photoreceptor cells, the rods and cones. But as we are getting older, you know, it's age-related macular degeneration. As we are getting older, a lot of things starts getting depleted. So you don't have enough. So the retinal pigment epithelial layer is now not performing optimally the function. So you then begin to have problems with the cone cells, which is highly aggregated there. And then the retinal pigment epithelial cells themselves, they are affected. The blood supply there is affected. The blood vessels are affected. And by the time you begin to have all this, you have some things that are called retinal pigment epithelial degeneration, which is an early sign. And then those vessels that are there, even the vessels from the choroid, you know, I said there are a lot of vessels. The choriocapillaries, you know, sometimes they may want to supply, but then you begin to have some deposition of lipofuscin, like fat substances, at the level below the retinal pigment epithelial layer, in between the retina and the choroid. And these are what are called drusins. These are tiny hard substances made up of lipids, you know, like fats, because part of the problem is with lipid metabolism, you know. So if you have problem with lipid metabolism, you are getting old. Okay, so now you can begin to think of the likely predisposing factors. Okay, the lipid metabolism, and then of course there is the issue of genetics. Genetics,
so genetics. Family.
Oh, it runs in family, and also what is called genetic polymorphism. You know, your genes just change. Some mutation just take place. For instance, age-related macular degeneration in the past, you know, we thought was not common in blacks. Of course, it's still not very, very, very common. But now, with civilization, with refined sugar constituting a larger proportion of our diet, you know, and lack of exercise, now age-related macular degeneration is becoming common amongst Africans, amongst Asians. Before, it was amongst the Europeans and, you know, the Americans. But now you have it in Hispanics, you have it in blacks, and you have it in Africans. And it's simply because of those predisposing factors, apart from age, apart from the genetics, you know. So the environmental effects, the dietary effects, all constitute, you know, contribute to it, as well as smoking. Smoking is
so smoking is also a risk factor now.
It is a risk factor in age-related macular degeneration, as also it is for cataract, as also it is even in patients who have diabetes.
But you know, when you say age-related, that means as you older,
usually above 50.
Because it's good.
Usually above 50.
You are just
the encyclopedia.
Yes. From all you have just said, one very important takeaway is the risk factors that you mentioned. But then, just hold it there. We want to keep a date with the physicians. Let us hear what you have to say about age-related macular degeneration. Smoking, they have said, is a risk factor. Let's hear from the public. We'll be back after this short break.
An elderly person that have lived up to 70, 80, 90, 100 years, all the nerves around the eyeballs and all other parts of the eyes, definitely they will grow weak and weary.
Yes, at least I have like two options. Number one, due to the age. Then secondly, staying long on phone.
Sometimes it's one of those things we consume at a very tender age, and the things we do, and another word to it, it might be hereditary as well.
I think about 3 or 4 months ago.
I think the one or maybe on 2 occasions that I actually went for eye check, it was my organization that actually brought some medical experts to actually check our size. And I did the simple test of closing one of my eyes and opening one to read the alphabet from far distance, and I passed the test. Ever since then, I've never on my own gone on a medical checkup to check my eye.
For me, it's to see the eye specialist so that they can give them advice on what to do.
I think practically the most important thing is to eat well and exercise well.
Welcome back. If you are just joining us, you're on to your regular program, The Physicians, where your health is our business. I'm sure you are actually taking a ride, a cruise with us, with Prof here in the studio, doing what she loves doing best. We're talking about age-related macular degeneration, and she has told us a whole lot about the risk factors, the ones that you have caused by yourself, and the ones that you decide to invite on its own. But then she's here to also give us the solutions how we'll be able to overcome it. If you are 50 years and above, it's time to sit down and take a rethink. Prof, you just told us about the risk factors. You said so much about the causes. Even before, it never used to be among the blacks. It's mainly something that you find in the Caucasians. But now it's been known that it's actually on the increase in the blacks. But then, how can it be managed? And what are the possible complications if it is not easily or detected early?
For early stages, now the symptoms, like I said, if it's just those drusen's that you have, especially the hard drusen's, it may not be symptomatic. The only time is when you see the eye doctor says, oh, you've got some things in your eyes.
Like a routine check or something.
That these are early signs of macular degeneration, age-related degeneration. So you then say, what do we do? Oh, all you need to do is just to be taking some vitamins. Of course, there are evidence-based study. The age-related eye disease study, which is called AREDS, and that study was done abroad, and there's the AREDS 1, AREDS 2, and they ended up with, okay, you can use, some vitamin C, vitamin E, and with zinc. Of course, there are some tablets that have everything together. That you have vitamin C, you have vitamin E, you have the zinc, you have the zeaxanthin, and then lutein and zeaxanthin. These are like oxidants that you have in the macula. Yes, and so you can take those ones, you can take them at that stage because you are asymptomatic. So you take it so that you prevent the progression, because it progresses. In fact, there are 3 stages. There is that early stage, and then the intermediate stage when patients now become symptomatic. And how do they present? Number one, they can still be seeing well. Some of them can still read well, but what they notice is there's a distortion in what they're looking at, which is referred to as metamorphopsia in medicine. And what happens is you're looking at, usually I use the window pane, the burglary proof you have on the window as an example. And then the individual sees that those lines are not straight. They are bent, they appear bent. By the time you begin to see that, or you think that you're looking at a pole and it seems as if it is bent, and then you ask somebody else, do you think that pole is bent? And he says no.
That's the hallucination they are talking about.
Yes, and hallucination, this Charles Bonnet syndrome also happens. Sometimes things just disappear, and then the individual thinks, what's wrong with me? And so it can be, and then but by the time it goes on and you haven't done anything at that stage, of course, at the stage of metamorphopsia, when you have distortion, it's still medical treatment. This same thing I have talked about, and it helps. If you start early, you can have some adjustments, okay, and it reduces, because what it helps to do is to stabilize the lipid metabolism. I said earlier on, there's a problem with lipid metabolism, even in them as well. Okay, and it is those things that are actually faulty, and the genetic predisposition, the genes that are affected during the mutations. Now, so at that stage, which is like intermediate stage, but if nothing is done, it progresses further, then the individual begins to see that when he's looking at somebody's face, you're looking at an individual, looking at the face, you can't see, you don't have the details of the face, but you can see every other part. And that could be disturbing. You're looking at somebody, the face you can't see very well, but you can see every other. So it is that central vision. You won't see, every other thing around you can see very well. So it affects central vision. But for some people, it may not just be right at the center. They may notice that there's like a patch when they're looking, like, you're looking at somebody and then something disappears from here. That also is part of the visual hallucination. And then, or you are reading, you notice that you are skipping a line. You are reading, even with the glasses, you see that, what is the problem? Or you think the room appears dark, let's put on light, So you have adaptation, so many things. So you need to get your eyes examined. That is the bottom line. So that stage, the vision loss just starts. It starts gradually from patches, and if nothing is done, until you now have the whole retina. The whole macula affected, and then that just blocks off the central vision.
Okay, so how do we, for advocacy, for people in the rural communities, how do you want them to cope? Because if you are in the urban area place, you can access health care and just check it. But those in the rural communities that don't even have access, is there anything, because you are a professional in that field, is there any association that is actually doing something in this regard to being able to pick up people that actually have this condition?
You see, surprisingly, it's said that people of low socioeconomic group, because of all the things that are attached to it, usually shouldn't. Like people who are in our own rural areas, because they eat fresh vegetables, they eat a lot of fruits, that is protected.
Awesome.
Okay, it is protected. And in fact, I was going through the literature and saw that pollution is also part of the things that will predispose you to it. Pollution,
yes. Urban area,
somehow urban areas.
Yeah.
So people in urban area are actually at a higher risk. They are more exposed. So people in the rural areas, you know, their diets sometimes would help in reducing the problem you have with the retinal pigment epithelial, because they are eating a lot of vegetables, they are taking a lot of minerals, and they are taking it fresh. You know. So, but be that as it may, you know, you definitely there will be some of them who would still go ahead and develop it. And what to do really is, you know, sometimes we have outreaches like in ophthalmology. We have each institution, like the tertiary institution, they have local governments, you know, like rural postings that the residents, they go there. And through all these areas, and in some of them, you actually have some community eye health workers, community extension workers, the CHUs, who can actually pick up such people from the community. And one thing we need to, first of all, establish is to let people know that old age is not synonymous with blindness. That is very important.
So, Adjola, it's always a delight having you on
my
set.
Pleasure.
And you just ditching out the points. It's stuff. It's good to have the stuff there. Thank you so much for coming on our program again, the physicians. And you can be rest assured that we will still call you again because they always ask, where is that prof? Where is that prof? Please, can you just bring her back? And thank God we brought you again and you've been able to enlighten us on age-related macular degeneration. Thank you so much. My dear viewers out there, you have heard it from the professor herself, the encyclopedia when it comes to things that has to do with the eyes. She's talked about age-related macular degeneration. And one thing that you have to take away from this is that it is now becoming common in our own environment. It used to be a disease of those, the Caucasians, but now as Africans is now actually very common because of the predisposing factors, the environmental pollution. We are beginning to live large, you're not exercising regularly, you're not eating right, sedentary kind of lifestyle. All these are the things that actually contribute to this. On that note, I want to say thank you so much for keeping a date with us. And again, till next time, ensure you always watch The Physicians. My name is Dr. Martina Agberian.
Thank you very much, Prof. It's always a delight, you know, having you on set, schooling us and dishing it out as it were. Please, if you're the type that like natural fruits, vegetables, stick to it. You've heard it now. No, people from low income earnings does not mean that because they are poor, they are going to have age-related macular degeneration. But because of the fact that they are close to the farm, eating natural fruits and their produce, they are healthier. So please stick to that and reduce the risk factors. Smoking, drinking, staying in high polluted areas, stay away from that. Of course, I remain Dr. Memuna Yusuf Kadri, and don't forget to follow us on all our various social media platforms. If you want to be a part of the show, you are just a click away. Till next time, stay blessed.
Dr. Chinasa Amadi, lifestyle medicine physician, certified weight loss coach and nutritionist. Founder Ariella Health and Fitness, and of course you can find us on Instagram or all social media platforms, Ariella Fitness. And hey, keep watching The Physicians. Don't miss anything.
Then we have other things, you know, like people at the risk of infertility because of age. I've mentioned it.
It has to do with hormonal?
Hormonal, because the ovulations are not coming on. The age is getting high, the hormones are not doing well, the hormones are getting low, the estrogen is low,